So let's begin. Hi everyone. Thank you so much for taking the time out of this lovely Sunday afternoon to join and attend our global launch here at LBIL. So just a couple of things before we begin. If anytime during the conference you may absolutely end the call, leave the call, and you can actually join again. It's just you have to use another email ID. Because we are making sure that it's secure and that we won't have multiple users of the same email ID coming in, okay? So please bear that in mind. So anytime you can leave, just when you come back, you use another email ID to rejoin the conference. All right, so let's begin. And as we begin the conference, all of you will probably be muted, including incoming users and members, but of course we'll have an extensive Q&A at the end of the conference. So that's when we'll open up the stage for discussions and any queries or clarifications you all will be needing. So Rishabh, if you can also go ahead and just make sure everyone is muted as we begin the presentation. Okay, and great, thank you. And I will now begin the presentation and share my screen. Is it okay now?
Yes.
Excellent. Thank you. Okay, so hello to all our fellow attendees and welcome to LBIL's global commercial launch. Today we're going to talk about all things related to digital healthcare. What does a virtual hospital on the cloud actually look like? And what it means to provide a platform for healthcare accessibility to all. We will be placing a spotlight on our newly launched platform, LBIL. We hope that after this conference, you will be intrigued enough to sign up on LBIL and use the features and services that we have created for you all over here. And to all our doctors, specialists, and healthcare providers attending today, we have loads to say on LBIL and Lymphomap's linkage, and therefore we hope that this conference encourages you to also sign up on Lymphomap if you haven't done so already. Now, before we begin, this conference will be recorded for training purposes, and also that our current members who are unable to attend today, if they've missed out on today's conference, then they can revisit it through the recordings that we will have. So we will, as I've mentioned earlier, we will be having a Q&A section at the end. So any questions or inquiries that you may have can be asked during that moment because we'll open up the stage for extensive discussions. So as always, we're here to answer and clarify any doubts that you may have. So let's begin. So there are a lot of disruptive technologies that I can list right now that's currently occurring in our society. There's 3D printing, 5G, which leads to improved connectivity, automation and robotics, virtual and augmented reality, so AR and VR. And one of the biggest ones, which will be a core focus in today's launch, is the digital workspace or digital platform. So even remote working or working from home is a big thing that our core team here at Lymphomap practices day in and day out. So we are also no strangers to utilizing disruptive technologies on a daily basis. Now, in connection to our last discussions that happened in Lymphomap's global launch, which happened last year in October, it cannot be denied that the leading disruptive technology has sneaked its way in every industry is artificial intelligence and machine learning. So these two disruptive technologies have become so predominant and snazzy, so to speak, that you can hear these terms in everyone's mouths, and of course, including Gen Z kids' mouths. So AI and machine learning are leading disruptive technologies that's clearly taking the world by storm. And the medical and healthcare industry is no exception or stranger to this supposed invasion. This leads to a couple main questions that will be discussed in today's conference. One of them being, what if AI and machine learning could assist in solving some of the most pressing issues in the medical industry? And what if we could save and assist countless lives globally, especially those located in rural communities, with the assistance of a disruptive technology that is essentially taking the world by storm? So these are a couple of questions that we will be deconstructing in today's conference. Now, it's no surprise that with COVID-19, digital platforms, digital workspaces, and healthcare applications are right at the forefront. So these are the best forms of healthcare in terms of individual consumption that's right in our pockets. So no surprise, we are very much living in the future. Everything is digital, everything is digitized, everything is AI and machine learning powered, including your smartphones and the gadgets you're using to watch this conference. So AI and machine learning and the algorithms and models created drive the things catered for your own preferences. Thus, today, you will discover numerous solutions that our platform has to offer to patients, non-patients, caregivers, and healthcare professionals on a global scale. We are here to bridge the gap that AI and machine learning have created and thus make healthcare accessible to all and make the whole process of utilizing a digital healthcare platform seamless and efficient. So before we bring up how LBIL can be a key asset in your healthcare and fitness journey, we will be discussing persistent issues that have caused a globally interconnected chain reaction. And we will also be touring our platform's multifaceted nature by showcasing every single functionality, feature, and service we have to offer. So it's going to be a detailed tour and a detailed practical demonstration. Now, the vibes that we are going on, or at least going for in this conference, is very different from how we presented our conference with Lymphomap's global launch last year. This conference is going to be very organic, as our motive is to make LBIL and Lymphomap attainable for everyone to use. So we really want to eliminate any sort of confusion or doubt and make it as easy to understand as possible. So let's begin our conference. Welcome to LBIL, an artificial intelligence and machine learning powered, globally networked virtual hospital on the cloud. So what is that interconnected global chain reaction that I was talking about? Well, we must look at the big picture issues that are currently occurring on our planet on a global scale. So the main takeaway from the chain reaction is the importance of digital healthcare innovation. Innovation by using digital technology transforms the way we are living and functioning today. As previously mentioned about remote workspaces, we can see that you can virtually do anything from the comfort of your home, whether it is working from home, doing schooling from home, or even mundane tasks like ordering groceries and medication, all from the comfort of your home. That has been expedited by the major global shift like COVID-19, which has catapulted us into riding full steam ahead with digitizing industries and functionality using our smart devices and gadgets. So digital technology has improved operational efficiency and therefore business in industries like manufacturing, finance, retail, and of course healthcare. They are using digital technology as optimization in order to improve customer expectations. And of course, we are no exception to that as we are dealing in the business of precision medicine, AI, and machine learning in collaboration with digital healthcare and digital platforms. So now let's explore some of the major foundations that act as an inception to this chain reaction. So in this section, we will look at some of the issues experienced not just by healthcare providers and experts, but also consumers, including patients, non-patients, and caregivers. So just a quick note for those who attended Lymphomap's global launch last year, some of these issues may seem very familiar as we did touch on them. But the reason we're again bringing them up is because they're interconnected with the global chain reaction. So let's begin. The first issue, which is a big one, is healthcare professionals' staffing shortages. There is a staggering doctor-to-patient ratio that is prevalent in developing nations, of course, but also in developed nations. In developing nations, the staggering doctor-to-patient ratio is there with larger populations and increased population density. Now, a thing that causes staggering doctor-to-patient ratios, not just in developing countries, but also in developed countries, is changing demographics and socioeconomic issues. So Ruben Hall, who is an excellent scholar, you can check out his article called How Today's Digital Health Solutions Are Solving the Biggest Problems in Healthcare. Excellent work, excellent article that he's written. He mentions and uses the United States as a case study where the pandemic, COVID-19, has caused about 3 in 10 healthcare workers to consider leaving their profession. Now, that is a huge jump from what was currently occurring prior to COVID-19. And another changing demographic case study that is discussed in Ruben's article is how there are greater senior populations located in many countries. Now, if we look at India in comparison, we are known to have a younger demographic. But if you take a G7 country like the United States as a case study, then they have a great senior population that carves up a huge chunk. So to refer back to Ruben's article, senior citizens with a 65 plus marker makes up around 17% of the population due to the baby boom crisis. And of course, the percentage itself is growing. And according to researchers and social scientists, the population growth is projected to go up to 22% of the US population. This is by the year 2050. So the emotional and physical stress of caring for the senior population is expedited by this particular changing demographic. Not to mention the advancement of technologies that assist in a greater life expectancy and greater healthcare needs. So even in countries with younger populations like ourselves, we do need to take into account that changing demographics and these forms of projected rates could very well be there for countries with younger demographics like ourselves. So you have a pressure point that's created with these changing demographics and socioeconomic issues. This pressure point is created within the healthcare industry to have nurses, providers, and experts to care for senior populations, but also deal with unexpected shifts such as future pandemics and viral outbreaks. The next issue is the absence and presence of big data. This was a big issue we were talking about in our Lymphomap Global Launch Conference last year. So the non-existence of an organized digitized system of health records, or just a lack of a digitized database or a digitized system, is something that's quite present in many countries. If we take us as a case study, so if we take India as a case study, handwritten records are still very much prevalent in many established institutions, and we don't really have an organized digital database located in many of these said institutions. But of course, this doesn't just go for India. It goes for other developing countries. It goes for those countries which have to deal with greater population densities, so on and so forth. But again, if we take us as a case study, then that is an issue that's currently there, the absence and yet the need for the presence of big data and organizing said data. The third issue is consumer expectations. So with the onset of smart gadgets, smart watches, Fitbit's really big still, and innovative healthcare fitness applications, healthcare is now quite personalized. So consumers are directly involved and are engaging in their own healthcare and fitness journeys, which means, or which causes, a greater expectation for quality healthcare from providers by utilizing direct involvement. So the preference and need for instant connectivity and the instant connection to healthcare providers, experts, doctors, professionals, you name it, is a big demand with consumer expectations, because now consumers are more aware of their own healthcare and fitness journey due to the trackings from these applications. Now, of course, distance is another big issue. Geographical barriers, regional barriers causes inaccessibility to healthcare and proper healthcare, so to speak. Now, of course, climate change, believe it or not, is a major factor in this shift, and weather conditions, environmental climate barriers causes lack of public transportation. There's poor infrastructure that gets thrown in the mix, so therefore causing healthcare inaccessibility for those living in rural communities or rural locations. And again, this does not just go for or count for developing countries. This also goes for developed nations, as there are big fractions of the population that do live in rural communities. Now, the last two, security and privacy, is a big one. So cybercrime and hacks into digital systems. So as the world is digitizing, cybercrime is also on the rise, which means there's a great risk of penetration into private health and patient records. So therefore, there's a need for cyber security. And finally, expenses. Again, bringing back the socioeconomic issues, the rise of medication costs, all of that stuff causes healthcare inaccessibility, or at least inaccessibility to proper healthcare. Now, if we take or statistically speaking, if we take the United States as a case study again, in 2019, the healthcare spending was 3.8 trillion US dollars, which is around $11,582 per person. And then by 2028, that's projected to be 6.2 trillion US dollars, which is $18,000 per person. So anybody who's living under the poverty line or anybody who's part of the working class, it is extremely difficult to have access to proper healthcare and proper medication. So these are some of the big picture issues that we need to take into account when we're understanding the need for digital platforms, digital healthcare platforms, and the need for these forms of systems to assist us in proper healthcare. So now that we know the issues, what is the solution? Well, the solution is up in the air, of course, digitally speaking. So remember when we were talking about being in the future? Well, fun fact, cloud computing, which is an integral facet of digital technologies, is a disruptive technology on its own. So in connection to solving all the issues, or at least dissolving this chain reaction, Lymphomap and LBIL's usage of cloud computing as well is the literal solution for all the issues we were talking about earlier. So the point is that you move almost all healthcare, including the bulk of all serious and rare illnesses, treatment, research, you name it, all to the cloud, and create a globally networked online healthcare ecosystem. And that is exactly who we are. That's where we come in. So Lymphomap and LBIL has an AI and machine learning powered integrated online digital health ecosystem on the cloud. And it combines 4 technologies, all right? The first one, of course, is artificial intelligence and machine learning. This entails classifiers, core AI engines, smart clinical, pathological, and radiological assistance. Now, I'm assuming that might sound a little too technical, but it's something that drives Lymphomap and drives the platform. Oh, I think there's a little bit of an echo going on. Tanesh, am I still audible?
No, I have fixed it. You can next time now.
It's okay now?
Yes.
Okay, excellent. Thank you. So that's the first part. Second technology is an online digital network of doctors, medical researchers, and healthcare professionals. The third is online digital medical workspace, including remote video conferencing. And the fourth technology, which is LBIL, is the digital front door for patients, non-patients, caregivers, the general public. So Lymphomap and LBIL is an intricate machine where these 4 technologies, these 4 gears, are actively working together to provide the best for both professionals, healthcare providers, and of course, the general public. So that is why I'm saying the solution is up in the air with us. All right, so what is Lymphomap? Now, last year, as I keep mentioning, last year in October, we went over a very detailed presentation of Lymphomap, and we had a very detailed demonstration on the technicalities and the AI aspects of Lymphomap, so we're not going to be doing that in today's conference. But I will give a quick deconstruction on what exactly it is. Now, firstly, you can check us out at www.lymphomap.ai. And we are an artificial intelligence and machine learning powered digital health ecosystem. So the unique features that Lymphomap has are, or some of them that we have, like I mentioned, a core engine of clinical AI and a peripheral engine comprising medical analytics and conversational AI. But the part that should be a bit more easy or accessible to understand is that we've created an online platform for digital healthcare comprising online video conferencing, remote medical workspace, remote treatment, and a full-blown research library called ORAC, where you can upload, download, and even collaborate with others on research papers, whether it's peer-edited, reviewed, all of that stuff. And finally, which is the key aspect, this is the linkage between Lymphomap and LBIL, is that online network of doctors, researchers, or healthcare providers that will connect with the users on LBIL. But more of that later on in the presentation. Now, the heart of Lymphomap, as I keep mentioning, is its core AI engine because it drives everything. Think of it as the motherboard, all right? So the core AI engine collects, generates, and collates data. It organizes data. So remember I was talking about the absence and presence of big data? Well, that is precisely what Lymphomap is doing, all right? So yes, it collects, generates, collates, all forms of related data, organizes them, stratifies them in order to build robust and efficient AI and machine learning algorithms and models. So that is the main thing that the core AI engine does. But particularly, it's an online digital infrastructure predicated on an online network of users that is needed to support two key trends that are shaping medicine and healthcare today. And that is precision medicine and remote treatment. A big disclaimer that I want to put out now that we're talking about Lymphomap is that we still haven't acquired or gotten the approval with FDA in the United States, and we're not yet at the trial stage. So all the utilization of the core AI engine that's happening with the data is all research-based. But of course, after we go through the trial stage and after we get the approvals from FDA, we will be able to push through with treatment protocols. But that is for later on in Lymphomap's journey. So you can already see how Lymphomap works in order to organize and assist in solving many issues. And the biggest new feature that is currently integrated is the consult section. And that is going to be showcased in today's demonstration for all the doctors and professionals that are attending today. Because this feature is that interlinking connection to LBIL. Now, very quickly before I move on to actually talking about LBIL, I would just like to bring your attention to these icons located on the right-hand side of Lymphomap's homepage or landing page. Whenever we have a big new feature or a big new service, we put an icon located on this portion of the dashboard itself. Any sort of big announcements from conferences, events, seminars, you name it, goes in our announcement banners over here, which is normally animated. For those of you who were probably seeing our marketing throughout till our conference today, you probably have noticed this animated banner that's been on both Lymphomap and LBIL. And of course, we have some other cool things like the pandemic simulator over here. But I won't go into that because we talked about it in Lymphomap's conference, and so you can check the videos out, and I'll talk more about that later on in the presentation. So enough about Lymphomap. Let's talk about LBIL. What is LBIL? All right, so LBIL stands for Lymphomap Biotech India Private Limited. So Lymphomap is in the name itself. LBIL is the teleconsulting division of Lymphomap. And it is an AI and machine learning powered, globally networked virtual hospital on the cloud that contains telemedicine facilities, including virtual OPD. So we're really taking or utilizing that aspect of remote to the next level. And it is the digital front door for the general public, patients, non-patients, and caregivers. We will explain a bit more about why we're constantly calling this the digital front door later on in the practical demonstration of our conference, so when the tour is actually going to happen. Now, of course, LBIL will enable the general public to globally connect with doctors who have chosen to teleconsult on the platform, and these are the same doctors and the same clinicians who are members on Lymphomap. So just like Lymphomap, our one-word solution on LBIL for inaccessibility to healthcare and connectivity is to digitize everything by moving everything to the cloud, hence adding to the ecosystem itself. LBIL has a multitude of services, multitude of features that we will be talking about, and I'm again going to draw your attention to these icons that are located on the homepage. So again, you can visit us on www.lbil.ai. These icons over here showcases the 5 big features or the 5 big services that we're offering on the platform itself. Keep in mind that the telemedicine facilities also includes virtual OPD, so for any sort of illness or any sort of or forms of healthcare consultations. And there is a patient data portal with direct and cross linkages with hospital and of course diagnostic labs, and more on that later. But the main feature or the unique core of LBIL, and again, we're going to bring this up and we're going to talk about this in detail, and I'm going to draw your attention to the heart icon over here, is the support groups and NGOs platform. So our NGOs and support groups database here on LBIL is the unique core feature on LBIL. It is the heart of it, and hence we literally gave it the heart icon because it is a very, very important feature of LBIL, and it is the unique feature of LBIL. So, moving on. The gears that are working together. If you are a doctor, researcher, or a professional, healthcare professional, affiliated with a hospital, medical institution, college, university, you name it, you must sign up on Lymphomap. All right. So if you want to professionally teleconsult, then you got to sign up on Lymphomap. But if you are part of the general public, so if you're a caregiver, patient, non-patient, you have to sign up on LBIL. On Lymphomap, the reason we're pushing professionals to Lymphomap is because of the consult feature that's already inbuilt into the workspace. So you will have access to professionally teleconsulting with LBIL users by clicking on that consult tab located directly on your dashboard. And therefore, you don't have to worry about even signing up on LBIL for that because you already have that feature on Lymphomap because it's two of them are gears working together. Both of them are interconnected. And as I keep mentioning, Lymphomap is acting as a motherboard for the functionality of LBIL's telemedicine and teleconsulting services. Now, one thing that I do want to mention before we even move on to the practical tour and the practical demonstration is that all our clinicians, doctors, and medical experts who want to professionally teleconsult.
The petitioner number one will have the custody of the child.
Oh, hello?
Considering the way.
Dhanesh?
Yeah, Achal, please carry on. I just muted.
Okay, great. Thank you. I thought there was a question, so that's why I paused. So where was I? Yes. So all doctors, clinicians, and medical experts at the time of signing up on Lymphomap, you must provide, and if you want to professionally teleconsult, when you're signing up for the consult section on our platform, you must provide a license and a registration number with a certified medical board or institution. And if your country or region does not have that, if they have a different system or a different process, then you must upload a certificate or some form of certification that proves that you're certified to practice medically and clinically speaking. Without this proof, the teleconsult or the consult tab on Lymphomap will not work. It will remain inactive. Plus, the Lymphomap admin team goes through a very serious checks and balances system to ensure that those that are actually professionally teleconsulting are legitimate and certified. The reason we're being so strict is because we want to eliminate any sort of fraudulence, any forms of catfishing, any sort of identity theft, which is why we're keeping this extremely niche and extremely strict, all right? Now, as I keep saying, LBIL, on the other hand, is for the general public, but what I want to emphasize right now is that if you are an NGO organizer, founder, manager, or if you are a support group organizer or manager, you must sign up on LBIL to register your NGO or your support group. So that is how we're organizing the two. All NGOs, support groups functionality is on LBIL, which is why if you're someone who's trying to register your NGO or your group, you must do that on LBIL. More of that demonstration momentarily. So now, very quickly, let's go over the features. Dhanesh, there's a lot of ambient noise in the background. Thank you. Can you look into that? Thank you. So now to go over the features, LBIL's features. So the reason we say look for the icons is because that's one of the core design things or design features that we're doing. We are using icons in order to make these features and services easily recognizable. So let's go over the 5 big features that LBIL has to offer. The first part, digital health records. So securely store all of your medical files in one place. Our digital health records is a place where you can store all your medical records, healthcare forms, whatever is needed to track your healthcare accessibility or healthcare journey directly on the digital health records section of LBIL. So the digital health records will also help doctors or any of the teleconsultants to instantly access your medical history seamlessly and hassle-free. So you don't have to, keep explaining or rummaging through copious amounts of documents that are loosely disorganized. You can just have them all accessible under one neat package. Digital prescriptions is another one. So after your online consultation, your doctor or your specialist may give you or prescribe medication. So we have a whole digital prescription section where users will be able to have access and a track record of past and present prescriptions and keep a track of their medication journey. So members will have a full-blown records because each prescription will have a unique barcode, digital stamp, and essentially is very much unified for that particular user so that you can keep track of your medication history. So no one else can penetrate that. That's essentially what I'm saying. As I keep mentioning, we are ensuring that everything is very secure. Privacy is also a big deal for our users, which is why everything is secure, everything's on the cloud, and everything is within the database, so nobody can hack or nobody can penetrate the system. That is why we have a unique barcode, a unique QR code, a digital stamp, all of that to protect your prescriptions. So of course, teleconsulting is the big chunk that's for LBIL. It's online consultation, which will allow you to connect with doctors globally in order for you to get the much needed care and attention you deserve. Now, of course, after booking an appointment on LBIL, you will receive notifications, including reminders of your sessions, directly to your email and phone number, which is why it is very important that at the time of signing up, you must give both your email address and your mobile number, because there's no password-based system. It's all OTP-based. And plus, by giving the mobile number, you will also get the notifications directly to your phone. And again, you can organize and keep a track record of all your appointments directly on the dashboard, but more of that later in the practical tour. And keep in mind that when signing up on LBIL, as I just mentioned, the whole mobile number and email address that you must provide, it tracks or it goes back directly to your account. So it's, again, a unique identifier for you, because we're eliminating any sort of fraudulence, identity theft, and catfishing, which is why we need both aspects of that. Now, the online therapy, think of it as an extension of teleconsulting, but here at Lymphomap, we're quite aware of how important it is to care for our mental health well-being and really and we bring an emphasis on that it's not just physical well-being, but also mental health well-being. So we have actually organized our whole online therapy section as another feature, even though you can think of it as an extension of the teleconsulting feature, but we wanted to organize that separately. So any psychiatrists, psychologists, or licensed therapists, if you want to connect with any of those medical professionals, then you just go to the online therapy section of our dashboard. And again, all the features that I'm going over, we're going to be showing that in the practical demonstration in literally 2 minutes. So bear with me. And finally, the big unique core feature of LBIL is the NGOs and Support Groups platform that we've built into the system. So at LBIL, we understand how important it is to receive the right attention and care during post-recovery stage or the aftermath of dealing with any sort of illness or traumatic event or whatever it is that we need support or we're looking for support. So this, of course, not just goes for patients, but also for caregivers and the general public. So here at LBIL, we have housed a specific designation or a workspace for our NGOs and support groups from all over the world to connect with one another and to also host webinars and meetings and connect and chat with one another and provide a safe outlet for support. But once again, I would like to reiterate that all NGO organizers, founders, and managers, you must directly create and register your NGO on LBIL itself, so you don't have to worry about going to Lymphomap. That is not for you. For you, it's LBIL. And licensed therapists and professional psychiatrists and psychologists, if you want to register your support group, then you must do it on LBIL itself. So you must create an account and then, of course, register your group on LBIL. But again, we will show that in the demonstration itself. And finally, before I actually pass on the mic for the practical tour aspect, just want to go over why we're putting such an emphasis on NGOs and support groups and mental health well-being, all of that stuff. So, as I keep saying, the most unique feature is the NGOs and support groups aspect, which is why we've provided and given it the heart icon, because we understand how important it is to have communal support. And there are so many countries in the world and so many cultures around the world where the communal spirit is deeply embedded into the ethos. Now, we were very fortunate these past couple of months to come across a very extraordinary NGO located here in Kolkata called ASHRAY. They are the Brave Warriors of Lymphoma, and we were able to get in touch with them due to Dr. Reena Nair, our senior consultant in clinical hematology from Tata Medical Center, Kolkata. So we were extremely fortunate to meet up with the wonderful members at ASHRAY and to just learn more about their journey, learn more about what they're doing, their motive, and and their motto in life. And after talking to Ashray, talking to the core members at Ashray, and also coming across some other NGOs located here in India, we realized that there is no unified digital platform. There's no unified digital platform. I mean, of course, you can create your NGO group or some sort of a public or support group on various social media sites. That is there. But there's no unified digital platform where you can organize meetings, host meetings, conduct webinars, advertise extensively through linkage, so linking your organization's platform to, let's say, I don't know, whatever other social media platforms that are out there, or whatever other social media outlets that there are present currently. And of course, the biggest one is reaching out to others beyond localized communities. So we realized that this unified digital platform was lacking, where you can easily connect with one another. You can easily meet up with other NGO organizers or meet up with other NGO members and just get that outlet for support that you're looking for. And another personal connection that the team or Lymphomap's admin team members have over here is that we have either volunteered and participated with NGOs around the world. We've also attended sessions with support groups to see how emotional therapy and how the process of acquiring mental health well-being is conducted. So there is a personal connection for us when it comes to helping out NGOs or providing an outlet for NGOs and support groups. So the main point is that we want to give a streamlined and easy to use platform where you have all the features of connectivity and collaboration. Because of course we know just how big these two pillars are when it comes to the functionality of NGOs and support groups. After all, no one is alone in their journey, regardless of the traumatic incident or disease or life-changing shift that one has experienced. We are all looking for some form of support and some platform or somewhere to be heard for. So the main features that we're providing when you sign up on LBIL for NGOs and support groups is the ability to chat with members and non-members, connectivity with global organizations, host meetings and public webinars to spread awareness about whatever cause you're advocating for. Hence, there will be a boost in marketing, and you don't have to worry about marketing yourselves because the platform is already doing that for you when you automatically link it with your social media platforms or anything of that sort. And most importantly, which is the biggest core feature, is an outlet for support. Most importantly, a safe and secure outlet for support. In the end, it's all about care here at Lymphomap, so we want to give the best possible platform, and that's why the past couple of months we really have been working hard to just formulate a platform that is easy to use, accessible, and promotes connectivity and collaboration. Now, before moving on with the tour, I just would like to point out that when you're registering your NGO or support group on LBIL, you must provide a website link to your group or to your organization. And we understand that some organizations don't have a website, so just you can attach some sort of a document that showcases your registration or the type of NGO or support group that you're running. End of the day, we don't want random groups to sign up and promote hateful speech or utilize the platform for detrimental means. That's why, to eliminate this sort of fraudulence or catfishing, we are ensuring that our NGOs and support groups that are registered on LBIL are protected from any sort of hacks or harmful cyber activities. So yes, that was one of the main things that I wanted to bring up in this section of my presentation. And now, on with the tour. So enough of me just going on and on about LBIL. Let's show you what LBIL is. Let's show you everything we got. So we're going to give you a detailed tour on how to sign up, on how to use the platform. Again, LBIL is a web portal, so we will be sharing the screen and showing you exactly how to use the features. And the detailed tour will be split into sections, so it will be showcased as both if you are a general public user on LBIL, and also if you're a professional utilizing the consult section on Lymphomap. So again, I would like to repeat and be very clear about this so that there's no confusion. The tour is going to be split into two big sections. One is if you are a general public user that's signing up on LBIL, we're going to show that. And of course, if you're a professional trying to use the consult section on Lymphomap. So that is the main thing that I want to bring to your attention. So I would like to now introduce to you all and pass on the mic to a key member of our core team member here at Lymphomap. I would like to introduce you to Mr. Dhanesh Prajapati, who is the Chief Artificial Intelligence Engineer here at Lymphomap. Dhanesh, I now pass on the mic to you. Please commence the tour of LBIL and the consult section of Lymphomap.
Okay. Thanks, Achal, and hello everyone to join us for our LBIL launch. So I will be showing you the whole practical example how you can sign up and use our platform. So Achal, please confirm my screen. I'm sharing my screen.
Sure.
So is it visible?
Yes, it is. Yes, it is.
Okay. Okay, great. So let me start with the explanation, like what exactly and what's the difference between LBIL and Lymphomap. So first of all, let's imagine that this is the hospital. Okay, that's one image. There are two buildings, a hospital building. Lymphomap, imagine this as a place where all the professionals sits in. While the main professional, I'm just saying the doctors, okay, who treat patient or who talk to the patient, to consult patient. So I'm just concising my whole pool to doctors right now, because on Lymphomap, all the healthcare professional can register, like from pharmacists to different like clinicians, surgeons for sure. So all of them can register on Lymphomap, but right now just let us consider it to doctors. Okay, so on Lymphomap, let's imagine all the doctors are sitting on this building. Now there is an LBIL, a general ward, okay, where all the patients comes in. Okay, now this building, the linkages are clinical, are digital clinical assistants. Okay, so there is a linkage here. When a patient books an appointment, it goes through this to a doctor, and doctor approves it, and then the patient and doctor can speak and talk. They can teleconsult on the same. Okay, so please remember, LBIL is for general public, general audience. Obviously, doctor can register on LBIL for sure, but it is more of a general public oriented. Lymphomap is more or less a professional network. We have a whole professional network. We provide multiple service on Lymphomap that we have already given a demonstration on, and it is available on our Vista page that Achal will be pointing out at the end of the section and at the beginning, which Achal already said. Okay, so let me start with the LBIL demonstration. So my demonstration will be in 3 stages. First will be LBIL demonstration, like how general public can book an appointment or take a teleconsulting appointment with a doctor. Second will be showing you a professional side of you, how doctor will confirm the appointment and how they can opt for the consulting section. And the third section will be the LBIL NGO and support group. Okay, so let me start with the LBIL sign up. So here's the LBIL page. So please note this, it's very important that the website which I'm showing right now, we have built this just for the demonstration sake. It's a dummy website. As you can see, it's demo LBIL, it's not our production website. So just to show you how things work and what the flow is, so we have created. So most of the data which I will be showing you, it's a temporary or dummy data. Okay, there are no actual doctors here in this website right now. We have created them for the sake of just to show you in the demonstration. Okay, so now if you want to join LBIL, just click on join. It's a sign up button. Provide some small details, the very basic details like first name, last name, gender, date of birth, email and mobile number. And please note, LBIL and Lymphomap, both of them are not password based login. They are OTP based login. So email and mobile number are important, obviously, and they will be verified post you submit it. So there will be an OTP verification. Once that is done, so whenever you want to log in, you just have to use your email or mobile number to log in. A OTP will be sent. As I mentioned, it's a OTP based login. Okay, so once you log in, this is how the dashboard will look like initially. Okay, now before I jump to the book appointment and our top toolbar, there are two things which I like to mention: health records and government ID. Let me show you. So there is a section called health records. So here you can upload your health records. We have two ways to upload the health record. One is fill up a form. We have created a form which I will show you. Secondly, you can upload a file. Let's say you are getting treatment for some illness, and there are few scan copies, prescription, some X-ray, sonography. Let's say, so you can upload all of them here with a title. Let's say, like for example, there is a kidney stone is going on. You took a sonography, so you can mention record title like kidney stone sonography. Okay. First, secondly, you can upload digital health record for yourself or your family members or your friends. Now, many times what happens, especially in third world countries, not everyone is familiar with the IT. Okay, they are not comfortable with browsing through or filling up the online form. So you can do on behalf of your family or your friends. So you can add their health records too if you want. because when you book an appointment, which I will be showing you in a second, so you can share this health record to that doctor whom you are booking an appointment to. That's the first thing. Now there is an ID section, an upload ID. This is required when the prescription is shared. I will be showing you, I will not upload right now, but I will be uploading later on when a prescription is shared to me, because prescription will not be shared unless and until the ID is are shared, because as you know that not all the drugs are available over the counter. You need a prescription with a doctor name, and RLB stamp and doctor name will be present there. So government ID, we do require a government ID from the patient, so to get access of a prescription. Now let me go through the top toolbar. We have two sections here, as you can see, doctors and online therapy. Okay, so now doctors are the one where all the doctors from the Lymphomap who has opted for consulting will be shown here. There are filters, as you can see, the doctor list. And please note, as I mentioned, it's a demo website. So these names are dummy data which we have created. As you can see, there is this Dr. Dhanishello. So as I mentioned earlier on, it's all dummy data. Okay, and we have online therapy section. Now online therapy are the doctor lists, but only related to the psychiatrist, a therapist, or whoever deals with the mental health issues. Okay, so all of those doctors will be shown in this section. It is an easy access for the therapy, online therapy section. Okay, so for the easy access, we have given you this separate page for this. And obviously those doctor will be shown here too in this list. And but if you want an easy access, you just directly want to book it, you can go it from here. Now booking an appointment is same for both online therapy and doctors. So let me just give you a demonstration from here. Book appointment. Before I book appointment, as you can see, there is a detail which are given. It's $10 fees for consulting, and department hospital is also given. If I want to check the whole detail, like what doctor has given, so as you can see, doctor name, doctor available days, available time, what language, city, department, and all. And there is this bio. Please note this bio. I will be showing you in the Lymphomap section. It's for professional one, that they have to write something like their experience, their specialty, how many patients they have treated, and how long they are treating this illness. So they can fill up that so the patient can read it through. Okay, so now suppose I want to just take a book appointment from Dr. Achal. So I will go to book appointment. Okay, and let's say I have, okay, as you can see, Achal has available, on Mondays and Fridays. So I took Monday, I chose Monday, and these are the times where she is available from 3 till 11 p.m. So let me choose 4, let's say. Okay, 4 p.m. Okay, so this is the time I chose. Now health record, as I showed you, I have uploaded already. I have already uploaded an health record. I will show you my dashboard again post my appointment is done, how easily you can access your book appointment and all. So there is one health record which I have already uploaded. I'm just selecting that health record, and comment, if I want to add some comment that doctor will read for this particular appointment. So let me add, let's say, okay. Now we also given an option. Now what happens if you book an appointment? Doctors did mention that these are the available slot, but there might be a case that doctor is not available at that time. Okay, so when you book an appointment, doctor may and may not be online at that time. So you can also upload a video message. If I click on the video message, it will show you to upload a video message. I cannot, because my camera and mic being used by this conference, but you can upload. It will use your own your laptop or mobile camera and mic, okay, to record a small video message for doctors. Okay, instead of writing, you just want to share a video. So let me go to book. So as you can see, I have asked to book an appointment, but now it will be proceed me for the payment, the consulting fees which doctor asked. So let me pay that. Just give me a second. Okay, so as I mentioned, these all are dummy account, everything here, just to give you a demonstration how the flow is. Let me log in. Okay, so I'm logged into my PayPal, and 10 USD, that was the consulting fees. Pay now. Okay, so my appointment is booked. now I can see my appointment. Once I clicked successful, you can see my top section is selected. I am directly redirected to my appointment section. Now it's pending. That means as I book the appointment, now doctor can approve the appointment after seeing all the details, which I will be showing you how doctor will view this, how it will look for a doctor in doctor's point of view. But right now, let us wait so that appointment is approved. Yeah. So as you can see, Dr. Achal Bhattacharya has confirmed the appointment and approved. So I can go to the info and you can see Achal is right now online, obviously. So I can directly call her. I can do a video call with her and directly start speaking. But let's say she's not online. She approved the appointment, but she's not online. She just went offline first for some reason. I can directly text her. See, so this text has been sent, so Achal can reply me if she's online. If not, to later on when she comes online, she can reply me. Okay, or else I can use my video call feature, so I can directly speak with her on this platform itself. No need to switch between different apps here. Now there is a section which is called prescription and remarks. Okay, I will be showing you like how doctors going to share it, but for patient, it's like doctor can add a remark to a patient. So Achal, please add a remark so I can. Okay, so as you can see, once the appointment is going on, so doctor can share a remark with me so that I can see this remark post my appointment is closed or not. Like please book an appointment next week same time. Okay, so yes, so that's the remark they have shared. The doctor has been shared, and after speaking, like I have a body pain. So let's say some drugs doctor is going to prescribe me. So the prescription will be shown here. So once doctor shared the prescription, yes, remark is there. Okay. So let's wait for doctor to share the prescription. Okay, so as you can see, doctor has shared the prescription with me. So view. So let me reload the page. View. Okay. So please see, this is how the prescription will look like. Dr. Achal Bhattacharya has shared the prescription with me. Okay, this is the drug that she prescribed. Frequency is there Monday after morning and afternoon, 5 days duration, 2 quantities. Okay. Now, as Achal mentioned in her presentation, that we have a QR code, barcode, a digital sign, and a digital stamp. Now QR code is very important. For example, as I mentioned earlier on, that there are many drugs that cannot be given over the counter. Prescription are needed, and so this file cannot be edited. It's, let's say they edit the file, so there is a barcode that we have provided. You can scan the barcode, at the same prescription you can see on the cloud. It's available to any pharmacist or anyone. Just scan this barcode and you can see the prescription on our website. Okay, so this barcode is required. As I told, every barcode is unique to the prescription and the digital sign. Every QR code, I'm so sorry, I mentioned barcode. Every QR code is unique to the prescription and the barcode too. Okay, so this is the digital sign that we add a unique number with a prescription, so that we can keep track of it, and you can scan this barcode, this QR code, and you can see the prescription. So this is how the prescription is. Please see, there is a special instruction section here which has not provided by doctor right now, because I think it's a small drug, let's assume. But the doctor can also add a special instruction for this drug. Okay, I will be showing you when I go to the doctor's dashboard. So this was the prescription and chat with the doctor. When I go back, so my appointment is ongoing and confirmed. Now, as you can see, as you can see, the appointment which I have booked, it is showing on my dashboard. Directly, easily access. It's there at the top toolbar too, but it's also there in my dashboard and shortcut path. Now there is one section in my dashboard which is called My Doctor. So what is My Doctor? So let's say I took the appointment, I took the teleconsulting from Achal. Now once I took it, as you have seen, the remark was I have to rebook an appointment after a week post the drug has been used. So I do want this doctor to be accessed, because there could be many doctors list. So I can add the doctor from here directly as my doctor favorite list. So this doctor will be added to my doctor list. As you can see, Dr. Achal Bhattacharya. So now I can directly book an appointment from here. Right now, the one appointment which is booked is currently ongoing. It has not been closed by the doctor. Okay. Now that is the one way to do that. And secondly, how you can add it a favorite in the consult form itself. There is a toggle button. You can directly add that doctor to your favorite list, like my doctors list. From here, toggle yes or no. So this was the two ways that you can add the doctors to my doctor list, which will be available on the dashboard. Okay, health records are available on your health record section, and I will be explaining you in my third section what is and how we can register NGO and support group. Now let's jump to the lymphomap demonstration. Now how it will look for a doctor. Okay, so now this is lymphomap page. Please note this is also an dummy page that we have created just for the sake of this demonstration. Let me reload again. Okay, yeah, so this is a dummy page. Okay, as you can see, test. Now it's all dummy data here. So but the flow is same, how you are going to opt for consulting and how you book an appointment and all. So there will be a consult section. Okay, and it will be only given to the doctors whoever are doctor registered on our lymphomap. They will have the option to be a consultant. Okay, teleconsulting. And there will be a form, like for example this, you have to fill up a form to become a consultant. So there are few details that you need to fill up, like language, what languages you are proficient with, what days you will be available. Okay, from Monday to Saturday. Let's say I'm not available on Thursday, I removed it. From what time to what time I will be available for consulting, like morning 12 a.m till 11:59 p.m. Okay, that's what I just given a random time. Okay, now this field is very important. License number and register portal. There are two things that you need to provide, either license number and the registration portal where we can check the license number, or that certification that has been provided by the respective lands government that a doctor can do the medical practice, right? So it has to be verified to check the legitimacy of the document. So this will, once you fill up this whole form and consulting fees, okay, it will be just USD. We will be removing all of this, so there will be just USD for the time being. And my bio, as I mentioned in that view in my LBIL section, there is a my bio section where patient reads it. So in my bio, doctor will upload his own data, like this many years of experience, specialty in this specific diseases or illnesses. So those all details can be entered here. There are few condition user agreement that can be read, and just after ticking those two, just submit. Now post submitting, you won't get direct access to consulting. No, the LBIL team will verify that first. The legitimacy of those documents which were provided will be verified first. Once verification is done, you will get access to our consult dashboard. Okay, so let's see how, if an appointment comes, how it looks. So team, please book a temporary appointment. So let's wait. Once team books a consult, a temporary appointment with Dr. Dhanesh. Hello. Okay. So as you can see, there is one patient that asked me to book an appointment, but you can see there is a payment pending. Okay. So till the payment is not passed through, I cannot confirm this appointment. But I can see what symptoms he has filled up. Okay. Uh, like symptoms is fever, appointment date and time he asked. Okay. Last diagnosis, as there are none, he didn't share it with me. Shared records that there are none, he didn't share with me. Communication is the main dashboard, but we will wait till the payments get successful. And also, once the patient asks for a consulting, you will get a mail and an SMS. Like there is a patient that asking for a teleconsulting. Now, as you can see, the payment has been gone. Payment is passed, so I can confirm this appointment. So let me confirm this appointment. Either you can confirm it appointment from this patient list, or I can confirm it from the patient dashboard. Okay, it's the individual patient dashboard. So let me confirm. Before I confirm, also see, as I mentioned, that there can be a video message that can be shared. So patient has not shared because our team is utilizing this conference, so camera and mic is being used, so they have not shared. So here I can view that video, or else I can share the video. Let's say patient is not online right now. Patients are online, as you can see, because they are right now booking the appointment, so both are online. But let's suppose they are not online, so I can also record a small video and share it with the patient, so that patient will see the video. Whatever patient has just shared with me, I can just give the solution and share the video directly. But let me confirm the appointment first. Yes, I want. Okay, now I have confirmed the appointment with Prince Tiwari. Okay, so it, there is a past data. As I told you, it's a dummy. We were doing some more consulting at the morning before this, so there are few messages, as you can see. So and patient is online. So online I can directly chat. Okay, I can directly chat with the patient here, and patient can respond because he's online. If not, then whenever he or she comes online, they can chat with me. And after doing that, I can add a remark for the patient. So this remark will be shared to the patient, as we have also given the same blurb here. So this remark will be shared to patient, but I can also take notes. Let's suppose this was the first appointment that patient came. Okay, this was the note which I have took and I kept it here. So let's suppose after a week patient again comes in. I don't remember because there are many patients which I am looking at. So I can refer to my notes which I have added. It will be linked to the patient to patient, so it's unique for every patient. I can add a patient note with this patient, with this patient. So there are notes which I can re-refer once patient rebook the appointment. And after that I can also share a prescription. After speaking to patient, there are few drugs that I want to give to the patient, so I can do that. So either I can add new, but as you can see there are pre given prescription are there, so I can edit those two. Like there are some cases where we edit the dosage. The prescription goes on, the same medicine goes on, but we like to reduce the strength of the dosage. Let's say I want him to take 100 mg of the same drug. Okay, add drug. That's the same drug. You don't have to fill up the whole form because the drugs which were already pre-filled in my previous prescription. Save and next. So now that prescription is shared, but as I showed you in the prescription box, I can add a special instruction. So here's the special instruction. Let's say I will be adding, if yeah, I'm just writing some random name here, but if this is not available, then take this as a special instruction in that prescription. Now also we give a small blurb to the doctor that if patient has not uploaded the government ID, he or she cannot view the prescription. Okay, so doctor can also inform the same to the patient in case if patient missed it. There might be a times where patient are not aware of this. Even we have given every section there is a blurb. I will be showing you in patient how it will be shown to them, but they cannot see. Now the prescription, you can also see the prescription. This was a special instruction and this was the drug that you have given, a doctor has given. So prescription info. Now once the prescription and everything is done, I have spoken, I have shared the prescription, the chat has been satisfied, I can just close the chat. Here's I have concluded my appointment. Now appointment is closed. So for patient, this appointment is closed. Now if patient wants, he has to rebook the appointment with me. Okay, so that's how the whole flow is for doctor and for patient. Let me show you the one which I have just mentioned about the prescription. As I have not uploaded my ID, so if I try to view, I cannot see my prescriptions. Okay, so let me show you if I upload an ID, just for example. Okay, I have a dummy ID. Here it is, PAN card. Okay, as you can see, it's temporary, it's dummy IDs, just to show you how it all works. Okay, upload, crop, upload. Okay, so my IDs are uploaded, which are visible in my dashboard in IDs, what IDs I have uploaded. And if I go to prescription and if I try to see, so this is how my prescription is visible now. Okay, the same prescription which I can download, reload, or print it out, or just show the digital copy to the pharmacy. So this was the prescription section. Now let us jump to the NGOs and support groups. So let me open my PPT. Now on NGOs, in NGO especially, we have three tags here. Okay, first is owner, administrator, and member. Okay, now what are these tags? Let me walk you through this, and I will be giving the demonstration too for that. So owner tag will be given to those who creates an NGO on LBIL. Let's suppose I am a user of LBIL, I create an NGO, so I will get an owner tag. Okay, now there are special privileges that owner has because he or she has created the NGO. The privileges are, I can accept the member request. Okay, what's the member request? I will just explain you when I explain the member part. But I can accept a member request if someone tries to join my NGO. Okay. Second privilege which I get is I can create meetings. Okay. Now please note, if you want to create a meeting with special teams, let's say there is an NGO who does two things like distribute food and give lectures or arrange an education lectures to poor kids, for poor kids. So these two are different tasks. Now there will be two different teams to handle that. So the owner can create meetings, two meetings, for one team for this one team, second is for the education one. So that meeting creation one is given, the privilege is given to the owner. Secondly, owner can give access, give a tag an administrator to a member. Now what an administrator is, I will explain you just post the owner. So only owner has this privilege. Okay, owner only can create an administrator. Okay, secondly, owner can create chat groups. I assume that everyone of you have used some or other kind of chat app where you create groups. Now let me go to the same example. If there is a food distribution and there is an educational class, like on Sundays to Sunday, an NGO arrange, so they can create two chat groups for the same, from the members which they have on the NGO in the LBIL. Okay, now what is administrator here and why we have this concept of administrator here? So what happens here? Now there are many kind of events that are organized in an NGO. Let's assume there is 2 to 3 food distribution happening on that Sunday with 2 to 3 different location, and that NGO is handling that. Now owner cannot take all the load to create a meeting, to create an event and all that. So he can give special privileges to few members, like there are few staff members which has joined that NGO. So they can create an administrator to them, they can give an administrator privilege to them. So administrator will have the same privileges as owner, except administrator cannot create any other administrator. Okay, so now suppose I am an administrator instead of owner, I cannot give an administrator access to other member. No, only owner has this access. That's the only exception for the administrator privilege. Otherwise, all creating a meeting, create a chat group, accepting a members, or everything can be done by administrator. Now thirdly, there are members. Now what are members here? Now suppose there are few volunteers. Let's say every now and then there are few students or few regular citizens who want to volunteer for NGO for some work. They can join the NGO as a member. They don't have any privileges, but they do can attend a meeting and they can be a part of a group. Let's say there is a food distribution group, you can add them to that food distribution group. That's all the member is. But member can be upgraded to administrator if need be. Let's say the member which judge just joined is sorry let's say the member just joined is a staff member, let's say. So let me show you how it's done on the NGO. So as you can see, there is a NGO section. So I can register an NGO, which I just told. So there is a small blurb that if you want, you can fill up the co-founder. I will show you I will show you how to fill the form. Just close. There is a small blurb that you can read out. Now NGO title. So let me create a small temporary NGO. Daman NGO. Yeah, that's my city name. Message. Ganesh Kumar is the founder. India is the country. Common community base. Now, as Anchal already mentioned in her presentation, we do need to check the legitimacy of the documents what NGO provides. Okay, that there will be some sort of documents. Either provide the whole website, so our team can look at that website and see through it, because all NGOs who have website, they mention their license numbers and all. Otherwise, NGO can provide the document, whatever document they have, either website or document. So just for explanation sake, let me okay, just as I told you, it's a dummy website, so I'm entering all the temporary data. That won't be happening in our production website, and also it will go to our administrator team, our admin team, to check. Okay, without that NGO won't be approved. So also I have a section called upload banner. I can upload some banner like say an image which showcases that what this NGO does and how many poor kids or how many people that NGO has helped. That the whole banner can be created and LBIL users can see those banners, and I will show you in a second how they can see. NGO description, like what we do. So let me just tap the, that's it. Okay, that's what my NGO does right now. And then, so as you can see, when I have created my NGO, it's pending. Okay, so my the LBIL team, the LBIL admin, will check the documentation, the legitimacy which the website and the document was provided. So once those checks are completed, the team will approve the NGO. So team, please approve. Yeah. So as you can see now, the tag changed to public. That means it will be shown to our NGO section, Daman NGO. Okay. So this one is my NGO. When I go to my NGO, yeah, there is one right now. Just a member has shown interest to my NGO. Hello, I would like to know more. Sure. So let's say that she is a staff member, for example. Achal is a staff member of this NGO. So Achal can request to join my NGO. So Achal, please request to join so I can showcase how to update member and yeah. So Achal just joined my NGO. So there is an owner. So I can approve this request. Okay. Once I approve the request, now I have an option to create meeting with Achal here. See, Achal name is showing. And I can create group, which I just mentioned that I can create groups with different members because Achal is a member here. Now, let me give administrator privilege to Achal. So if I click on member, I am giving her an administrator access. So now she is an administrator. Now, Achal, please approve Prince request. Now there is one more member who wants to join. Let's say he is a volunteer. He comes and goes now and then. He comes in Sundays to Sunday. So see, I haven't approved this, but he was approved. So administrator have a privilege to approve a member. Now Prince is also a member. Okay, and Rishabh, I am approving Rishabh. So now if I go to a meeting, let's say I want all of those three to be in a meeting, so I can add them directly. Just these two I want, so I can add one by one, or else I can click on all members. Like all the members in the NGO will have the access to this meeting, and I'm scheduling this meeting, let's say today by 1:18 till 2:18. And create. Okay, so this meeting is created, as you can see, and it's accessible. Everyone can join. The members, whoever are the members, can join this. The meeting will be shown to them. I will show you how. So they can join the meeting as it is active, directly clicking and joining the meeting, and they can discuss whatever they want to plan. We also gave a notes section where you can take notes, some minutes of meeting, let's say, and these notes are unique to individual. Like my notes will be different than Achal notes. This won't be shared to Achal. It's just my personal note. Okay. Yeah, I just want to add this. So this is the notes which I took from this meeting. Okay. Also, we have a section which I just mentioned. I can create groups. So hello. So that is a group name. Either I can add the members or I can make this group public. Now, what is the public group? Let me create a public group. So public group is, hello, this is the public group. There is a public tag. So this group will be available to all the users of LBIL, all the members of NGO and the user. Whenever some user goes in some NGO like this care for you, there is an NGO. So now there is no public group here, but if there is a public group, I can directly start chatting in that public group. Everyone can chat in the public group in that NGO. So NGOs can see and help and talk to them. Now there are few members. Let's say hi. Okay. Now Prince is typing in this group, as you can see. Achal has sent me a text. Okay, so this is the chat section. As you can see, public group. Hello. So we can chat. It's a public group for whole LBIL, so everyone can chat on this. So this was the NGO. Now let me show you how I can join. And also, as I told you, I can add a banner. So this is the banner which NGO can add. For just to explain, we have added some random image, but it can be a banner that NGO adds, and I can see like what they do and what not. After seeing this, I want to chat with that NGO, so I can go and I can chat with the NGO. Hello, like this. And Achal is the one who is the owner of this NGO, and there are no administrators, so I cannot see. Okay, so as you can see, I can this. And if I want to join the NGO, unlike this one, the one which I have created, I don't see join button. There is a team button. But if I go to some other NGOs, I will see join button. So I can join this NGO. I can request to join as a member, as an administrator. That's it, not as a member. So this is how the whole NGO section work. And if the meeting is created, the meeting will be shown here, which I created here. Can you see in this NGO? This was my NGO. So in that previous NGO, if a meeting is created, I can see here. Okay, so I can join if I am a member of this NGO. So this was the NGO section. Now let me show you how support groups work and how to register a support group. So the dashboard is same as you've seen, the chat messages, the notes, the meetings, everything is same. The only difference is there are no administrator and members per se. There is just owner. Only one individual creates a support group who has an authority to create or can create like a legal license, for example therapist or psychiatrist or some NGO member who has done the support group work previously. Okay, so they do have to provide some sort of proof there, and they can create their support group. So the privileges are same. They can create group, they can create a meeting, they can take notes, okay, and they can accept members here too. So this is the support. Hold on, sorry for that. So here's the support group, and I can register support group from here. Let's say I'm an individual, I want to register support group. So these are the form, this is the form. So I can just create a support group, a temporary support group. 12 step help. No, it's not hello, let's say group, just for the sake of this. India KCP. Okay, now I do have to upload some sort of document to showcase that I can give assistance to those who want to deal with some sort of trauma, right? So a psychiatrist or a therapist. So I do have to include some sort of document here, and the support group description. So right now I don't have anything. So let me close that. Once you do that, so the same way, the flow is same. It will be pending till our team approves it. Once it approves, so support group will be visible to our support group section. So now there are two support groups, as you can see. I have previously created one for this tutorial, and there is also one therapy for all. So the work, if I open this, hold on, yeah. So as you can see, the everything is same. It's all similar. They can create meeting. I can join this so that I can be a part of a meeting, because these will be private meetings. There won't be any public meeting. So yeah, meeting can be created, notes can be taken from the user and the owner. So support group is same. The whole working is the same as NGO, but it's a new concept that we have added on our LBIL, okay, which Achal has already mentioned and explained in an elaborate manner. Now let's suppose in website there are many times some technical issue comes in. Okay, it's not in our control. There could be some sort of weather issue somewhere, so some issue happen. So we have provided an help section, okay, where okay, I think I have clicked this. Okay, we do have a help section. Hold on, let me show you this. Okay, so there is an help section which we have given to all the LBIL users, same as Lymphomap. On Lymphomap 2, we have given an help section. So if there is an issue, they can send a request, send a message to our team. So please note, this is not a chat section. So there is a team which will look into this message, and they will see that they will reply accordingly later on. So it's not a live message section in the help section right now. Okay, so this is the help section which we have provided for the LBIL user that they can take help of. Now we also have added, there are few future features that I would like to mention here that we are working on, currently ongoing work. So first is on LBIL, register my LBIL. Okay, hold on, my NGOs. Okay, now there is this chat section where you can see there are chat going on, but there are no filters like members and LBIL user who are just came here to query. They are not member, they just want to know about this, they want to talk to someone or get in touch with someone. So all the user will be shown in here in this list, but in future we will be creating a separate list like all users and members. So list will be like just members, no one else, and LBIL users who are came here to just chat and query, like I did in this group. I just came and started chatting with Achal, right? So there will be filters. That's the first task we will be integrating soon. And there is the second thing that we are also planning to do is a volunteer page. Now what happened many times, definitely NGOs do promote in social groups and social platform for sure, but we also provide a volunteer section for our LBIL users, like they can opt to be a volunteer, and NGO can post advertisement there if they are looking for a volunteer in so and so city, let's say, and there are members who were like opted to be a volunteer in so and so city for so and so date. let's say every Sunday evening I am available to volunteer for any NGO in Daman, let's say. So I can be a part of that. So we are creating a page where NGO can post an advertisement for asking for volunteer, asking for donation, or asking for whatever the things that needed to be done for the NGOs. And LBIL users, we will be adding that to their Reddit profiles where they can opt for it. They want to donate something, let's say they want to donate the money, or they want to be a part of, they want to be a volunteer, let's say, okay, or regular volunteer to an NGO. So they can do that based on the volunteer page. So that is also an ongoing work that we are integrating on our LBIL platform. So this was the future discussion and like future work that we are integrating. Soon it will be there. And so yes, this is the whole LBIL, our virtual hospital, and our Lymphomap. One new feature that we have added as a which is called consulting. Okay, so a doctor can become a consultant. So that's it from my end. Thank you for being with us and coming to our global launch conference. I will hand over mic to Achal. Hello, Achal.
Yes, hi, Dhanesh.
Yeah.
Great.
So please.
Great. Thanks, Dhanesh. So just a couple of final words, like concluding stuff before we end the conference. But before I do that, I would like to take this moment to introduce our product development team. So our small team that created LBIL, and we've been working day and night to create this product for the past couple of months. And of course, we are also the team behind creating Lymphomap's whole workspace. So I'm going to start off by introducing our backend developer, Rishabh Pandey. So Rishabh, if you can just take 2 seconds in introducing yourself, what you do, who you are, that will be great.
Sure. Hope I'm audible.
Yes, you are.
Okay, so quickly introducing myself, I've been working within the core team as a backend developer, as Achal has said. Majorly, we make sure that everything behind the scenes, which you see on the UI behind that, goes fine. So yeah, just the clear aim is to lay out these products for the public use and their good. Yeah, thanks all.
Great, thanks Rishabh. So I would like to now introduce our front-end developer, Prince Tiwari. Prince, if you can introduce yourself to everyone.
Yes, myself Prince Tiwari. I am front-end developer, web designer. I have developed LBIL, whole design and front-end functionality. Also, I have developed Lymphomap, front-end whole functionality, chat, video calling, everything. Yes, or thanks all. Yeah.
Okay, great. Thank you, Prince. And finally, last but not least, our chief AI engineer, Dhanesh Prajapati. So Dhanesh, again, if you could introduce yourself and what you do.
Okay, yeah. Hello, everyone. As I have given the demonstration, so myself, Tanish Kumar Prajapati, my city you have seen, it's Daman. And yeah, I'm a core AI engineer. I create AI toolkit for our Lymphomap and NB Task, and also I'm developing the app for the same for the both the platforms. That also soon it will be out in few months. So yes, that's it from my end. Thank you.
Great. Thank you so much, Dhanesh. So I'm just going to share my screen to show you guys the final slides for our conference. Okay, great. So very quickly to conclude the conference, a little bit about our digital footprint and what we're doing at Lymphomap and LBIL. For those of you who may not be familiar, what is a digital footprint? Well, it's basically the information about a particular person or entity that exists on the internet as a result of their online activity. So the point is that here at Lymphomap, our digital footprint, like we're making some great strides with it. And because connectivity is key with us, we just want to be, or at least talk about how interconnected we are with the global community and how we are reaching out beyond our localized communities as well. So like I said, we want to connect with the global community out there. And of course, we are not necessarily a social media site, but because of our interconnected web portals and managing an online network of professionals and now an online network of users that are going to sign up on LBIL, we want to make sure that we are constantly there for you guys and that we're constantly in connection, so that any sort of queries or doubts or just concerns or suggestions, anything you guys might have, or if you just want to talk about AI, machine learning, digital healthcare, anything with us, then you can absolutely connect with us. So if you are on LinkedIn, you can follow us on our official company page, Lymphomap Inc. We're very easy to spot out. You can literally just type in Lymphomap Inc. and we're there. All news pertaining to Lymphomap and LBIL, any new videos that go up, any new features that go up, marketing is always done here on this platform. And basically, if you just want to know what we're doing, then we post here regularly so that we can connect and ensure that you guys are aware of what features we're launching, what services we're launching, or exactly what we're doing. So if you're on LinkedIn, do find us. We're Lymphomap Inc. Even LBIL's news is going to be here. So it's just one page for both entities. And another one is our YouTube channel. So we regularly do post videos. I mean, because we've been working on LBIL for the past couple of months, we haven't been posting videos, but we do have some video series lined up. We're gonna have some really cool short videos about AI and machine learning, digital healthcare, you know, just have some fun little tutorials, fun little videos so that anybody who's a layman can also understand exactly what we're doing, and just because, like I said, we want to eliminate any sort of gap or space. We want to be that bridge for everyone so that you can easily access concepts that may have been just too difficult to understand. So as you can see, our Lymphomap Global Launch Conference that happened last year, we have a created playlist, so you can check that out on YouTube. We were also extremely fortunate. We were very, very glad that Ashray chose to host their public webinar on our platform, and we have that whole webinar recorded and neatly packaged under this playlist called Ashray's Public Webinar. And of course, we have videos coming up under LBIL's global launch. For example, those who have missed out on this conference as well will be able to access videos pertaining to LBIL right here in this created playlist. Another thing I would like to draw your attention to is our Vista page, which you might have heard also Dinesh was mentioning, our Vista page on during his practical tour. So our Vista page is essentially our media page, and the icon we've used is an eye icon. So anything that we're doing media-wise, whether it is producing short films, creating short videos, anything that we're creating that's content-wise related to Lymphomap, LBIL, AI, machine learning, digital healthcare, and also in the future, if there are any collaborators that want to collaborate and make videos with us, then everything will go up on our Vista page. But one thing that I would like to keep you guys in the loop in is that we have a separate exclusive Vista page for our Lymphomap members. So I don't know, maybe you guys noticed that when Dinesh was giving the consult section demonstration that there was an eye icon located on the main taskbar on top. So that's where all our exclusive videos are. So some of the things that we are not publishing publicly and that those are catered for our Lymphomap members will be in the Lymphomap Vista page for members. But we do have a public Vista page on our landing page, and we will be implementing the same icon on LBIL whenever we're creating videos for LBIL. Even in the future, if we have NGOs or support groups who want to collaborate with us and make a video series or film series, whatever it is, then we will be posting that on LBIL's Vista page. So we have lots coming up with Lymphomap and LBIL, and that is why we really, really hope that you guys stay in touch with us, keep in tune with what we're doing, because we're just not stagnant. We're working furiously to instill and implement just really new content out there. All right, so just to conclude, what was the point of this conference, the point of this demonstration, and everything we've been talking about lately? Well, despite the boom in various teleconsulting services and applications, we are taking a different approach when trying to marry the fields of AI, machine learning, precision medicine, and digital healthcare. Sure, there are other platforms that utilizes disruptive technologies as well, but what we're trying to do is marry them and unify them under one neat package. So the healthcare industry is evolving, I mean, just like every other industry, and of course to our doctors and specialists attending today, that's no surprise to you all. But what we need to take into account is how fast the industry is evolving and just how intensely artificial intelligence and machine learning has seeped into every facet of said industry. The way we live, the way we function, the way we interact with one another is affected by these two disruptive technologies. And then, of course, when you throw cloud computing in the mix, then forget about it, right? So with LBIL and Lymphomap, we want to give you an inclusive, all one-stop shop where you can have access to services that cater to your specific needs. Whether it's teleconsulting, connectivity, collaboration, as we saw with the NGOs and Support Groups section, or if you just want to store your personal health records, your whole medical history, or you just want to keep a track of your healthcare and fitness journey, then we are really trying, or we've provided a platform that kind of houses all of that under one neat umbrella, right? And of course, with the problems and issues that we discussed earlier today, we want to give you a space, a very safe space where you can seek out support, because that's where we particularly come in. Now, the point is that with disruptive technologies, we are taking control of these technologies, and we're providing a platform that's easy to use, accessible, and also affordable when it comes to your personalized healthcare and fitness journey. So instead of feeling intimidated, because I mean, let's face it, there are some platforms that may seem intimidating, or these concepts may seem intimidating to some of us. The point is that we want to eradicate that form of intimidation. Sorry about that. But we want to eradicate that form of intimidation, and we want to provide a platform that's simple and easy to use. Hence the usage of icons, colors. We've also used dark mode for our design so that it's ergonomically and user-friendly. So here at Lymphomap, we are looking at every aspect from design to technical functionality, because we know that we want to give the best to our customers and consumers out there. So finally, despite all the hardships, climate change, devastating sociopolitical, socioeconomic issues that are currently happening in the world today, here at Lymphomap and LBIL, we are optimistic and believe that instead of envisioning a dystopian future, we dream and build towards one where our future generations can utilize technologies and scientific advancements for the benefit of humankind. We do believe that our platform is that bridge that combines supposed distant worlds, and that it will greatly assist everyone in the medical and healthcare industry. So the future is not at all distant, it's very much here, so why not be a part of something that will build a better tomorrow? Welcome to the world of LBIL and Lymphomap. Thank you so much for attending our conference. Please do check out our websites. Please join. Take the advantages that we are giving to you guys through our services and features. And as always, if you want to connect with us, please feel free in contacting us at info@lymphomap.ai or info@lbil.ai. All of our contact information is on our websites. Connect with us on LinkedIn. Check out our YouTube channel, our Vista Media page. And of course, check us out at www.lymphomap.ai, www.lbil.ai. We have lots to show. We have lots more things coming up, and we are not stopping. So that's there. Thank you so much for attending our conference. We now open up the stage for any questions or discussions you guys want to have. But thank you again so much, everyone, for taking the time out to attend. So, yeah. And if you have any questions, just you can unmute your mic.
Yeah, if anyone has to have any question, they have to unmute their mic. They have muted the mic. Sure, so
no questions, but thank you so much. I mean, we really have to go through it, and then things will become more clear. That is what I felt from my end.
Absolutely.
And it looks very, very simple. Hopefully we'll be able to, manage. And so let's see.
Thank you so much. That really means a lot. Like I said, we're very fortunate to be working with you and Ashray as well, and we really hope we can give the best back to the community as best as we can. But definitely, if ever you run into any snags or issues or anything, just hit us up. Like, let us know. We're here 24/7 to help you out. So we really hope you like the platform. That's the main thing.
It's very nice. It looks very interesting, very nice, very new also, and very helpful.
Thank you so
Definitely.
much. Thank you so much.
Thank you.
Okay, so I think there are no questions. So yeah, thank you all for coming and joining us on our global launch of LBIL.
Thank you so much, everybody. You can just click end call and
Yeah.
conference is done.
Yeah.
Thank you. Have a good day, everybody. Have a good Sunday.
Bye.
Bye-bye.
Bye.